Hello everyone. Let us discuss today about the non-renal excretion pathways. So in my last video we have discussed about the excretion, mainly renal excretion route. The excretion means the removal of drug from the body. So removal of the drug can be done mainly by renal pathway, that is by kidney, and some other non-renal routes also there for excreting the drug out of the body. So what are the non-renal pathways are? Next to renal pathway, biliary excretion plays an important role. Then there are some excretion pathways of drug through saliva, and the drug can be excreted through milk also. Also minor pathways like pulmonary excretion route and through skin also some drugs gets excreted. So these are all some non-renal pathway of drug excretion like biliary excretion, salivary excretion, milk excretion, pulmonary excretion and excretion through skin. So biliary excretion mainly excretion of drugs through bile, whereas through saliva it is salivary excretion, and if it is excreted in the milk of the mother, then it will be ingested by the infant. So that also may affect the effect of the drug in the infant. So that is also to be considered. That is milk excretion. Then pulmonary excretion, excretion through lungs, and sometimes the drug may excreted through skin also. These are all the minor pathways, and these two are the very minor, having very less excretion mechanism, which is least important, because very few drugs will be excreted through this pulmonary or skin excretion. So let's start with the biliary excretion of drug. So biliary excretion of drug means excretion of drug through bile. Once the drug is orally administered, the drug will reach the stomach, intestine, and then into liver. Through liver it will reach the bile, and from bile again bile will be secreted to the intestine. So some drugs from the plasma will be secreted to the bile, then intestine, then to liver, and this type of cycling is known as enterohepatic cycling. What does it mean? Enterohepatic cycling of drug. What is that enterohepatic cycling means? Entero means intestine, hepatic means liver. The drug moves from the intestine to liver, then from the liver to again through bile back to intestine. So this type of cycling, until the drug will be completely excreted out from the body, the drug will have this enterohepatic cycling. Entero means intestine, hepatic means liver. So when the drug moves from the intestine to the liver through this bile, some drugs will be excreted through the bile from the blood. So what type of excretion will take place through this biliary excretion is? Biliary excretion is an active process. The point to be remembered mainly in these non-excretion processes are whether they are active process or passive process. So biliary excretion of drugs are active process. That means they need some carriers to transport the drug from the blood to the bile. So the drugs mainly excreted through bile, they follow active transport mechanism. So the drugs, as it is active transport mechanism, they are also competitively inhibited. What does it mean? Competitively inhibited? Those drugs which can be excreted through the bile can be inhibited by the competitive drugs, like the anti-cancerous drugs, methotrexate. It has biliary excretion of drug. So the drug methotrexate excreted out from the body through bile. But when you administer probenecid, like yesterday in renal excretion also, tubular secretion was inhibited of penicillin was inhibited by probenecid. Here biliary excretion of this drug methotrexate was inhibited by probenecid. So if you co-administer probenecid with methotrexate, methotrexate will not get excreted out and it will be circulated in the body for a prolonged period of time, and this may cause toxicity in the body. So methotrexate, as it is anti-cancerous drugs, most of the anti-cancerous drugs are toxic to the body. This has not been excreted, then it will cause toxic effect in the body. So that is known as competitive inhibitor. So this is the property of an active process. So since biliary excretion is an active transport mechanism, it is also having competitively inhibited issues. So the drug will be circulated in the body and the half-life of the drug will be increased because of this competitive inhibition behavior of this biliary excretion of some drugs. Also, mainly, which is the main factor which will affect the biliary excretion? It is the molecular weight. So molecular weight of the drug plays an important role in biliary excretion. So when the drug will have less than 300 Dalton, if the size of the drug is less than 300 Dalton, then that will be excreted through urine. Mainly when the drug is of 300 Dalton or up to 500 Dalton will get excreted through bile. So bile generally of about 0.5 to 0. ml per minute will be the bile excretion rate. So bile is secreted from the bile duct, that is about 0.5 to 0.8 ml, and the drug will be dissolved in this 0.5 to 0.8 ml. And it is the property of the drug, that is molecular weight of the drug, determines the biliary excretion. If the drug will have molecular weight of 300 to 500, that will get excreted through bile. And it will, when the drug will be excreted through bile, it will be removed through the fecal matter. When the stools will be removed from the intestine, through bile, the drug which have been excreted through the biliary excretion also will be removed through this fecal matter. So biliary excretion, to remember the points are, it is excretion is an active process. As it is active, they can be competitively inhibited, and the main point to be remembered is the molecular weight plays an important role in biliary excretion. So mainly the drug whose molecular weight is 300 to 500 Dalton will get excreted through bile. So next excretion is salivary excretion. Now what type of transport takes place in salivary excretion is passive. Salivary excretion is a passive process. That means the drug movement from the blood to the saliva is by passive transport mechanisms. Why it is passive? When there is high concentration in the blood and low concentration in the saliva, the drug movement will take place from blood to the saliva, and the pH of saliva is about 6.5, which is slightly acidic than that of the blood pH. What is the pH of blood? It is 7.4. So compared to blood pH, salivary pH is slightly acidic. So what are all the factors which are going to affect the salivary excretion of drugs? Since it is passive process, we know already unionized drug, lipophilic drug will have passive transport mechanism. So since it is, this excretion is also passive, so mainly ionization constant of the drug, that is pKa, as well as lipophilicity of the drug, and also the protein binding nature of the drug. Only the free drug can reach the saliva. In protein binding also I mentioned, only the free fraction of blood will get equilibrium with that of salivary pH, because protein bond fraction cannot enter the saliva. It cannot permeate through the membrane and it cannot reach the salivary membrane or salivary region. I'm sorry, not membrane, salivary region. So mainly the factors which are influencing the salivary excretion of drugs from the blood are the ionization constant of drug, that is pK of the drug, that must be unionized in nature, and lipophilicity of the drug, that is the drug must be lipophilic in nature, and the third is the protein binding of drug, that is the drug must be free in nature, that is unbound, not bound to any protein. Those will excreted through the saliva. So the saliva to the plasma concentration will be determined by these three factors. Now, when the drug is weakly acidic in nature, this ratio, that is ratio of the drug from saliva to plasma. So, which type of drugs can pass from the saliva to plasma? this ratio will be less than 1. Why it is less than 1? Since the plasma is comparatively basic in nature to the weakly drugs, the acidic drugs in basic medium will get ionized. So very less amount of drug will reach the saliva. So less amount of drug in saliva, more amount of drug in plasma, which will be less than unity, which is known as the salivary drug concentration will be less than that of plasma. Whereas for weakly basic drug, if the drug is basic and in basic pH of blood, basic drug, then it will get unionized. So if the drug is unionized and it is acidic medium, so this unionized can easily move. As the salivary excretion is passive process, this unionized drug can move to the saliva. So more amount of drug will be present in saliva and less amount of drug in the plasma. So this ratio will be greater than unity, that is 1 for weakly basic drug. For weakly acidic drug, saliva to plasma drug concentration will be less than 1. That means salivary drug concentration will be less, plasma drug concentration will be more. Whereas in weakly basic drug, saliva to plasma drug concentration will be greater than unity. Matlab means salivary drug concentration will be more and plasma drug concentration will be less. Also, the point to be remembered, another point is the salivary excretion of drugs. Mainly, which type of drugs will be excreted through saliva means it is the weakly basic drugs. Almost all the weakly basic drugs will get excreted through saliva if it is not protein bound in nature. Also, the salivary excretion of drugs, like in some antibiotics, you might have faced this problem that when you consume some antibiotics like metronidazole, tinidazole, even mebendazole, all the anthelmintic drugs, these anti-amoebic drugs, they causes some bitterness or some metallic taste in your tongue. Why? Because those weakly basic drugs will get excreted through saliva, because of which you feel the taste of the drug. This feeling taste may not be pleasing. Some cases, salivary excretion can be used in treating some diseases, like in case of lingual nigra. What is lingual? You might have heard this term. Sublingual means tongue. So beneath the tongue is known as sublingual. So lingual means it is tongue. So nigra means black. So there is a condition known as black hairy tongue. There will be black hairy tongue disease is there, for which you need treatment of antibiotics. So antibiotics which are weakly basic in nature can be given administered orally, which has been administered orally, but it will treat the black hairy tongue. How the tongue will be treated? Because of the salivary excretion of such antibiotics. So this salivary excretion can be used beneficially for treating some oral related disease also, like salivary excretion of drugs. There is another excretion, that is milk excretion. So to summarize the salivary excretion, let me summarize it. Salivary excretion is a passive process. Since it is a passive process, what are the factors which will affect the salivary excretion of drug? That is ionization constant, lipophilicity and protein binding. In ionization constant, drug must be ionized. In lipophilicity, drug must be lipophilic. And in case of binding, protein binding, the drug must be in free form. Those will get excreted through saliva. And salivary pH is slightly acidic, that is about 6.5, which is acidic than blood. So when the drug is weakly acidic, will have less than unity, the concentration of drug from saliva to plasma, whereas that ratio will be greater than 1 for weakly basic. That means salivary excretion of weakly acidic drug is less than weakly basic. Weakly basic drugs will more excreted through saliva. So excretion of drug through saliva can be used in treatment of some diseases like black hairy tongue, where the antibiotics just given orally also can be excreted through saliva, and it can be used for treatment of such diseases. Now next is milk excretion. What does it mean, milk excretion? So the drug which has been administered to the mother who has ingested, the drug which has been administered to the mother, there are possibilities that the drug can be excreted in milk, and that milk which has been ingested by the infant may have some effects. So that also to be considered. Sometimes it may be toxic to the infant. That dose may be toxic dose for the infant. So you have to consider about the milk excretion also. Again, milk excretion is a passive process. Milk is slightly acidic in nature. It is mainly contain fats and proteins. So again, protein binding also may affect. Again, ionization and lipophilicity, since it is fat, and the binding fraction. Like salivary excretion, here also the milk is slightly acidic, so ionization constant. Milk contains fat, so the lipophilicity of the drug. Also it contains proteins, so protein binding of drug may affect the milk excretion of drug. So when you consider the M/P ratio, that is concentration of drug in milk to the concentration of drug in plasma. Again, acidic drug will have less excreted in milk, whereas basic drug will have more excretion in milk. So again, this M/P ratio have to be calculated. Along with, you have to calculate the steady state concentration, how much the constant concentration of drug has been reached in the mother's milk. So this steady state concentration can be calculated as dosing rate. Dosing rate means how many times we have administered how much amount. That is dosing rate into F upon Cl. F is the bioavailable fraction, that is bioavailability of the drug upon clearance. If you just multiply dosing rate into bioavailability upon clearance, you will get the steady state concentration. So to calculate average drug that is excreted in milk can be calculated as multiplying this M/P ratio multiplied by CSS. First of all, you have to calculate the M/P ratio, then you have to calculate the CSS, that is steady state concentration. Multiplying these two, you will get average drug that has been excreted in milk. If you know how much drug has been excreted in milk, now how much amount of drug will reach the infant, whether it may be toxic, whether it is to be concerned, is it a concerned matter or not, that can be decided only when how much amount of dose has been excreted in milk and how much the infant is going to take. That has to be determined by considering, that is, the amount of drug the infant will get administered or ingested is calculated by multiplying average drug concentration, that we have calculated by multiplying M/P and C, average drug concentration of drug present in milk multiplied by volume of milk, how much milk the child has been ingested. If it is less, then less amount of drug will reach. If the volume ingested is more, then that will have more amount of drug to be ingested. So if you know how much amount of drug is being or is going to be ingested to the infant, you can calculate or you can determine whether that amount is going to be toxic or not. So whether it is going to be a concern or not, that has to be determined. Significant fact, if it is that milk excretion is going to be a significant effect or not, that has to be calculated by calculating how much amount of drug will be taken by the infant. So you have to calculate first of all M/P ratio, then CSS by calculating dosing rate into F upon Cl. Multiplying these two, you will get average amount of drug that has been excreted in milk. If you know the average amount of drug that is being excreted in amount, and if you know the volume of maximum up to the optimum volume of milk that is to be ingested by the infant, if you multiply those two, you will get how much amount will be probable to administer to the infant, whether it may be toxic or not, or it is going to cause any effect or not. Is it in therapeutic level or in toxic level or in suboptimal level? That can be calculated after calculating this. So you have to consider the milk excretion of the drugs also. So milk excretion, it is a passive process. Milk is acidic, so ionization constant. Milk contains fat, so the lipophilicity also contains protein, so protein binding of drugs also to be considered in milk excretion of drug. And the minor route of drug excretion is by pulmonary excretion and skin excretion. Pulmonary excretion is excretion of drug through lungs. Mostly the drugs which are in gaseous state or the volatile drugs like general anesthetics, the drugs which are volatile in nature, ethanol, these all can be excreted through lungs. Since they are gaseous in nature, they may through exhalation, some drugs which are gaseous or which are volatile in nature can be excreted through lungs. Like example, in case of general anesthetics as well as some ethanol can be like chloroform, so halothane, these all can be excreted through this lungs. Lungs are responsible for excretion of some volatile drugs or gaseous drugs. Now, what are the factors which are going to affect this lung excretion or pulmonary excretion is that solubility of drug in gas. In oxygen, how much your drug is going to be solubilized and it can be exhaled along with the air. So, how much the solubility of your drug in gas, that also to be considered, and also the respiration rate, how faster or slowing the respiration rate, again going to affect the excretion of drug through lungs. So these all to be considered. Since it is minor, just some points have to be remembered. Now skin excretion. Again, skin excretion is done by passive diffusion. So the drug from plasma through the skin. Sometimes we feel the smell of drug in somebody's. Like when they take some drugs, they will they will have that smell. Sometimes obnoxious smell will be there. Like in example, alcohol person will have smell in their skin. Why? Because those drugs also will be excreted through skin. They can be excreted through pulmonary as it is volatile in nature, and some can be excreted through skin also. So the drugs like benzoic acid, ethanol has excretion of drug through this skin. Since skin excretion of drug is also following passive diffusion, so the lipophilicity of the drug, ionization constant of the drug plays an important role in skin excretion of drugs. So that's all about the non-renal pathways. Again, this is important for the exam point of view. Sometimes only the non-renal pathways of drug excretion might be asked in your exams, competitive exams, in case of some short notes. Maybe in competitive exams, you can go for that biliary excretion, which type of excretion it may be, active or passive. So you must know which is the active. So biliary excretion is an active process. Salivary milk is passive process. Again, pulmonary is a passive process and skin excretion is again the passive process. Mainly, biliary excretion is by active process. So those, whether it is active or what are the factors determining, just like biliary excretion, molecular weight plays an important role in biliary excretion. Here, three parameters for this too, that is ionization, lipophilicity as well as protein binding. You should know which type of excretion is there in which type of drugs. So you must know all these points, you must remember all these points in competitive exams, and for short notes, it may be asked like write notes on non-renal pathways. Then you have to mention that other than kidney, the organs responsible for excretion are, list out all the five like salivary excretion, biliary excretion, milk excretion, pulmonary excretion and skin excretion. Then explain one by one. So we have completed all these movement of drugs, that is absorption, distribution, metabolism and excretion. Now in my further videos, we will start with the bioavailability, bioequivalence and the most important part of this Biopharm subject, that is pharmacokinetics, in our next videos. Thank you.